Welcome to Magical, the medical mystery education hub. Today we are going to learn about blood clotting, clotting factors, and coagulation cascade. For better understanding, we have divided the video into three parts. The first part is about blood, hemostasis, and coagulation. So, to start with the basics, we must know that what is blood. Blood is basically a connective tissue. You can also say that blood is a liquid connective tissue that is responsible for circulation, respiration, nutrition, and many other functions. Blood cells are produced by bone marrow within the bone. Bone marrow stem cells developed into RBC, WBC, and platelets. Certain WBC mature in lymph nodes, spleen, and thymus gland. Mature blood cells have varying lifespan. RBC circulate for about 4 months, platelet for about 9 days, and WBC cells range from about few hours to several days. Blood cell production is often regulated by body structures such as lymph nodes, spleen, liver, and kidney. Now let's study about the components of the blood. So the components of the blood are basically two components. We have the formed elements and we have the plasma. The formed element comprises of about 35% of total blood volume and plasma for about 55% of total blood volume. The formed elements basically includes three types of cells that are present in blood. We have the erythrocyte that are also known as RBC. We have leukocyte also known as WBC, and we have thrombocyte also known as platelet. The plasma is composed of again two factors or two constituents. We have the blood that is 92 to 92%, and we have solids that are 8 to 10%. The solids are composed of organic and the inorganic part. The organic part are the protein which are formed in liver that are 7 to 8%, and inorganic is about 0.9%. The organic part is composed of again three parts. We have the albumin, we have the globulins, and we have the fibrinogen. Albumins are about 38 to 60 gram per liter, globulins about 20 to 30 gram per liter, and fibrinogen is about 2 to 4 gram per liter. The globulins includes alpha 1, alpha 2, beta, and gamma. Now let's talk about the hemostasis. Hemostasis is basically the process of arresting bleeding following a vascular injury. And coagulation is the final step of hemostasis, in which a stable blood clot is formed by platelet and insoluble fibrin network. The hemostasis is basically composed of two words. The very first is heme and the second is stasis. The heme means blood or hemoglobin and stasis means to stop. So we can say that hemostasis is a process to stop bleeding or to stop the flow of blood. Now let's talk about the biological definition of hemostasis. Hemostasis is a precisely orchestrated, arranged process involving platelets, clotting factors, and endothelium that occurs at a site of vascular injury and culminates in the formation of a blood clot, which serves to prevent or limit the extent of bleeding. Now, let's talk about hemostasis. Hemostasis is basically of two types. We have the primary hemostasis and we have the secondary hemostasis. The primary hemostasis basically is a process of microcirculatory bed, and it occurs by constriction of blood vessels and formation of platelet plug, whereas secondary process involves coagulation and it stops bleeding due to the formation of fibrin network that is insoluble. Now let's talk about the factors affecting hemostasis. In this, we have five factors. The first is the plasma factor, the second is the platelet factor, the third is the erythrocyte, fourth is the leukocyte, and the last is the tissue factor. These factors can influence the hemostasis. Now let's talk about the events occurring in hemostasis. There are total 4 events in hemostasis. The first is arteriolar vasoconstriction. The second is primary hemostasis. The third is secondary hemostasis. And the last we have the thrombotic and the antithrombotic events. So let's talk about the arteriolar vasoconstriction. It occurs immediately and reduces the blood flow to the injured area. It is mediated by a reflex neurogenic mechanism and followed by the local secretion of factors such as endothelin, which is a potent endothelium-derived vasoconstrictor. This effect is transient, however, and bleeding would resume if not for activation of platelets and coagulation factors. Now, let's talk about the second part, that is the primary hemostasis. In this, disruption of endothelium exposes the subendothelial von Willebrand factor and collagen, which promotes platelet adherence and activation. Activation of platelets results in the dramatic shape change as well as the release of secretory granules. Within minutes, the secreted products recruit additional platelets which undergo aggregation to form a primary platelet plug or the primary hemostatic plug. Now let's talk about the third event, that is the secondary hemostasis. In the secondary hemostasis, we have the deposition of fibrin. Tissue factor is also exposed at the site of injury. So the tissue factor is a membrane-bound procoagulant glycoprotein that is normally expressed by subendothelial cells in which the vessels walls such as smooth muscle cells and fibroblasts are there. Tissue factors binds and activates factor 7, setting in motion a cascade of reactions that culminates in the thrombin generation. Thrombin cleaves circulating fibrinogen into fibrin. Now let's talk about the thrombotic and the antithrombotic events. In this, polymerized fibrin and platelet aggregates undergo contraction to form a solid, permanent plug that prevents the further hemorrhage. At this stage, counter-regulatory mechanisms are set into motion that limits the clotting to the site of injury. This was all about the blood clotting or the hemostasis. So we will study the next about clotting factors. So thank you for watching this video. You can watch the group of videos on biochemistry in the playlist. So you can follow us on different platforms and do hit the like button and do subscribe.